Dr. Thrixvell had performed over 3,000 surgeries in his 50-year career. 3,000. And not once, not a single time, had a patient opened their eyes during the procedure, looked directly at him, and said, "Hey, doc, you might want to check that lateral incision. Looks a bit shallow." But then again, none of those 3,000 patients had been human. The operating theater aboard the medical frigate Sanctuary Prime was state-of-the-art. Well, it had been state-of-the-art 2 decades ago, which in galactic medical terms meant it was practically ancient, but it still worked. Mostly. The surgical lights hummed with that particular frequency that suggested they might give out at any moment, and the environmental controls kept the room at a balmy temperature that Thrix found comfortable, but his assistant, Nurse Quilix, complained made her scales itch. "Vitals are stable," Quilix announced, her 4 eyes focused on the monitoring equipment. "Heart rate is elevated, but within normal parameters for a human under anesthesia." Thrix made a clicking sound of acknowledgement, his primary manipulator arm steady as he worked on repairing the damaged tissue in the human's abdominal cavity. The patient, one Marcus Vale according to the medical file, had been brought in after a particularly nasty encounter with a malfunctioning cargo loader. The machine had decided, in its infinite mechanical wisdom, that Marcus looked like an excellent place to deposit 300 kilograms of industrial equipment. Humans were surprisingly durable, Thrix had learned. Most species would have been paced. Marcus had merely suffered severe internal injuries, broken ribs, and what the humans called a punctured lung. Still alive. Still breathing. Absolutely ridiculous. "Anesthesia levels?" Thrix asked, making another careful incision. "Optimal," Quilix replied. "He should be completely unconscious for another 2 hours minimum." That was when Marcus's eyes snapped open, not gradually, not with the slow, confused flutter of someone emerging from sleep. No, his eyes opened like someone had flipped a switch, alert and focused, and they immediately locked onto Thrix's face. Marcus said, his voice rough but coherent. "Is that my spleen?" Rose. His secondary arms, which had been reaching for a cauterization tool, stopped mid-motion. Quilix made a sound that could only be described as a combination of a gasp and a strangled wheeze. "You are supposed to be unconscious," Thrix said slowly, his translator rendering his native language into human English with perfect clarity. "Yeah, well," Marcus replied, apparently unbothered by the fact that his abdomen was currently open and his internal organs were on display. "I have always had a weird reaction to anesthesia. My body processes it too fast or something. Could you maybe check that connection on my left kidney? I'm getting a weird, tingling sensation." Thrix stared. Then he stared some more. Then, because he was a professional with decades of experience, he looked down at where Marcus was somehow feeling something despite the nerve blocks, and noticed that, yes, there was indeed a slight issue with the vascular connection. "How are you?" Thrix began, then stopped. "Why are you not screaming?" "Screaming seems counterproductive right now," Marcus said reasonably. "You are kind of in the middle of putting me back together. Screaming would just make things harder. Plus, I can't really feel pain at the moment, so that's nice. The drugs might be wearing off, but the nerve blocks are solid work, Doc." Quilix had backed away from the operating table, all 4 of her eyes wide with what Thrix recognized as pure, unadulterated horror. "He is awake. He is awake and looking at his own organs. This is not normal. This is not okay." "I'm getting that impression," Marcus said. He tried to lift his head to get a better look, and Thrix's upper left arm shot out instinctively to press him back down. "Do not move," Thrix commanded, his voice tight. "You are currently held together by my hands, medical adhesive, and hope. If you move, things that should stay inside may become outside." "Fair point," Marcus acknowledged. "So, how's it going? Am I going to make it?" The sheer absurdity of the question, asked so casually while the patient in question was splayed open like a biology textbook, finally broke through Thrix's professional composure. He laughed. It came out as a series of clicking chirps that made Quilix look at him with concern. "You humans are insane," Thrix said, returning his attention to the kidney connection that Marcus had somehow sensed was problematic. Completely, utterly insane. Yes, you are going to make it. Your species is infuriatingly difficult to kill. Thanks, I think, Marcus said. Hey, can I ask you something? You are asking me questions while I am performing surgery on you. I do not think I can stop you. Why are you using clamps on that bleeder? Wouldn't cauterization be faster? Thrix paused again. He looked at the bleeder in question. He looked at Marcus. He looked at Quelix, who had returned to the monitoring station but looked like she wanted to flee the room entirely. How do you know medical terminology? Thrix asked. I don't, really, Marcus admitted. But I can see what you are doing, and I watch a lot of medical shows. Plus, common sense. You are trying to stop blood flow, right? That thing there is leaking. Seems like closing it off permanently would be better than just clamping it. The thing was, Marcus was not wrong. Thrix had been planning to cauterize it after stabilizing the other damaged vessels, but doing it now would actually be more efficient. The human, lying on a table with his guts exposed, had just given him valid surgical advice. Quelix, Thrix said, his voice carefully neutral. Please bring me the micro-cauterizer. You are taking medical advice from the patient, Quelix said flatly. The patient is not wrong. The patient should not be conscious. And yet here we are, Marcus chimed in cheerfully. Living in interesting times, as they say. Doc, while we are at it, I think you missed a small tear in the peritoneum. Upper right quadrant. It's minor, but it might cause problems later if you don't seal it. Thrix followed Marcus's line of sight. Sure enough, there was indeed a small tear, barely visible, exactly where the human had indicated. A tear that Thrix had not yet noticed because he had been planning to do a thorough inspection of that area in approximately 15 minutes. How are you seeing that? Thrix demanded. The angle is wrong. You should not be able to see that section without moving, and I told you not to move. Reflective surface on your instrument tray, Marcus explained. I can see the reflection. Not perfect, but good enough. Plus, I'm pretty sure I felt it happen when the cargo loader hit me. There was this weird popping sensation right before everything went black. Thrix set down his tools. He took a moment to breathe, or rather, to cycle his respiratory gases in the manner his species found calming. Then he picked up his tools again and began sealing the tear that should have been invisible to the patient. I have been a surgeon for 50 years, Thrix said as he worked. I have operated on 63 different species. I have repaired injuries that should have been fatal. I have reattached limbs, regrown organs, and once successfully separated conjoined triplets from a species that reproduces by budding. Never, not once, have I had a patient provide running commentary on his own surgery. First time for everything, Marcus said. If it helps, you are doing great work. Very steady hands. All 4 of them. It does not help. Sorry. They fell into a strange rhythm after that. Thrix would work on repairing the damage, and Marcus would occasionally point out something he noticed, or ask a question about the procedure, or make small talk, as if they were meeting at a social gathering rather than in an operating theater with one of them opened up like a maintenance hatch. Quelix had given up on finding normalcy in the situation and had instead begun documenting everything with her personal recorder. Medical history, she muttered. This is either going to be a groundbreaking case study or evidence for a malpractice hearing. Both, probably, Marcus said. Hey, Doc, question. Is that orange fluid supposed to be there? Thrix glanced at the orange fluid pooling near Marcus's liver. No, that is a chemical irritant from the cargo loader. I need to flush it out before it causes necrosis. Necrosis sounds bad. Necrosis is very bad. It means tissue death. Yeah, I definitely don't want that. How are you going to flush it? Thrix explained the procedure as he performed it, partly because it helped him focus, and partly because Marcus seemed genuinely interested. The human asked intelligent questions, made occasional observations that were surprisingly insightful, and somehow remained completely calm, despite watching his own organs being manipulated by an alien doctor with 4 arms. "You are handling this remarkably well," Thrix observed as he finished the irrigation procedure. Most beings would have gone into shock by now. "I figure panicking won't help," Marcus said with a shrug, or at least, in the approximation of a shrug that someone could manage while strapped to an operating table with their torso open. "Besides, this is kind of fascinating. How often do you get to see your own insides working? It's like watching a really gross educational video, except it is me." "Your psychological profile must be very interesting," Quilix said from her station. "You should see my therapist's notes," Marcus replied. "Actually, no, you should not. Doctor-patient confidentiality and all that. Speaking of which, Doc, I think you have got everything major handled. The big stuff all looks good now. But there are a few minor vessels that are still seeping. Nothing critical. But you might want to address them before closing up." Threx looked. Marcus was, once again, correct. The human had apparently been conducting his own internal examination of the surgical field while Threx worked. "Your observational skills are exceptional," Threx admitted. "I'm very motivated to make sure this goes well," Marcus said dryly. "Survival instinct is an excellent teacher." The surgery continued. Threx repaired the minor vessels. He reconstructed the damaged lung tissue, using a biopolymer scaffold that would help Marcus's own cells regenerate the organ. He carefully realigned the broken ribs, injecting them with bone growth accelerant that would have them healed in a fraction of the normal time. Through it all, Marcus watched, commented, and occasionally cracked jokes that ranged from mildly amusing to absolutely terrible. "What do you call a doctor with 4 arms?" Marcus asked at one point. "I do not know," Threx replied, carefully suturing a layer of muscle tissue, well armed. The silence that followed was profound. "That was bad," Quilix said. "That was terrible," Threx agreed. "I have been lying here for 2 hours watching my own surgery," Marcus said defensively. "I'm running low on material. Give me a break." "I am literally giving you a medical break," Threx pointed out. "I am repairing your broken body." "See, that is funny. You have got a good sense of humor, Doc." Despite the absolute insanity of the situation, Threx found himself warming to the human. There was something admirable about Marcus's ability to remain calm and even jovial in circumstances that would reduce most species to gibbering wrecks. Humans had a reputation in the galactic medical community as being absurdly resilient, both physically and mentally, but Threx had always assumed the stories were exaggerated. Apparently not. "We are nearly finished," Threx announced, beginning the closing procedures. "Your internal injuries have been repaired. Your lung is reconstructed. Your ribs will heal quickly with the accelerant. You will need to remain on the ship for observation for 3 days, but you should make a full recovery." 3 days? I can do 3 days. Any restrictions after that? No heavy lifting for 2 weeks. No strenuous activity for a month. Regular check-ins with medical staff to ensure the regenerated tissue is integrating properly. Got it. What about the anesthesia situation? Is this going to be a problem for future surgeries? Threx paused in his work. It was a remarkably practical question, and one that deserved a proper answer. "I will make a note in your medical file," he said. "Your metabolism processes standard anesthetics at an accelerated rate. Any future medical procedures will need to account for this. We will likely need to use a combination of different agents, possibly including some human-specific compounds that are not part of our standard inventory." "Makes sense. Humans are weird, metabolically speaking. We can eat a lot of things that are poisonous to other species." "Yes, we are aware," Quilix interjected. "Your species' ability to consume and survive what other species consider deadly toxins is well documented and deeply disturbing." "I mean, chocolate is poisonous to dogs," Marcus said. "But humans love it." "Biology is weird." Thrax asked, beginning to close the external incision. "Small predators we domesticated thousands of years ago. Now they are pets, companions. We love them, even though they sometimes eat things they should not, and we have to take them to the vet. You domesticated predators, Thrix said slowly. Sure. Also horses, which are prey animals that can kill you with a kick. And cats, which are obligate carnivores that only tolerate our presence. And birds, some of which are smarter than human children. We are really good at befriending things that probably should not want to be friends with us. Quilix made a note on her datapad. Adding befriends dangerous species to the human behavioral profile. It is a long profile, Thrix muttered, sealing the last layer of skin. There, you are closed. The procedure is complete. He stepped back, all four arms finally still, and allowed himself to feel the exhaustion that had been building for the past 3 hours. 3 hours of surgery. 3 hours of working while his patient provided live feedback. 3 hours of questioning his life choices and wondering if he should have specialized in something less stressful, like diffusing unexploded ordnance. Thank you, Doc, Marcus said, and he sounded genuinely grateful. I know this was not a normal surgery. I appreciate you rolling with it. I did not have much choice, Thrix replied, but there was no heat in his words. You were not going to conveniently lose consciousness. Probably not. My body is stubborn like that. Your entire species is stubborn, Quilix said, finally abandoning her monitoring station to begin the post-operative cleanup. It is your defining characteristic, that, and the ability to survive things that should kill you. We prefer to think of it as determination, Marcus said. But yeah, stubborn works too? Thrix removed his surgical gloves, depositing them in the biological waste receptacle. His hands, all four of them, ached from the precision work. He was too old for these kinds of surprises. He needed a drink, or possibly a long nap, or both. I am going to write a paper about this, he announced. The first fully documented case of a human patient remaining conscious during major surgery and providing useful medical input. It will either make my career or make me a laughingstock. Why not both? Marcus suggested. That is not helpful. Sorry. Medi. Quilix administered the post-operative medications, carefully adjusting the dosages to account for Marcus's apparent superhuman metabolism. She set up the monitoring equipment that would track his recovery, muttering to herself in her native language about humans and their ridiculous biology. You will sleep now, Thrix told Marcus firmly. These medications will ensure it. No more waking up during medical procedures. Fair enough, Marcus said, already starting to sound drowsy as the drugs took effect. Thanks again, Doc. You did good work. All four arms. Go to sleep, Marcus. Going. Just want to say, though, this was the weirdest day of my life. And I once accidentally joined a religious cult while trying to buy groceries, so that is saying something. Thrix decided he did not want to know the story behind that statement. He watched as Marcus's eyes finally closed, his breathing evening out into the steady rhythm of medically induced sleep. He is stable, Quilix confirmed, checking the monitors. Vitals are good. Brain activity is normal for human sleep state. He is actually unconscious this time. Good, Thrix said. He felt like he had aged 10 years in the past 3 hours. Very good. I am going to my office. I need to sit down and possibly question my choice of profession. You did well, Quilix assured him. It was an unusual situation, but you handled it professionally. I took surgical advice from my patient. The patient was right. That is not the point. But it was, in a way. Marcus had been right about the bleeder, about the tear, about the seeping vessels. The human had, against all logic and medical protocol, been a helpful participant in his own surgery. Thrix made his way to his office, collapsed into his chair, which was specially designed to accommodate his species' unique anatomy, and stared at the wall. After a long moment, he activated his personal terminal and began typing his incident report. The patient remained conscious during surgery, despite adequate anesthesia, he typed. Patient provided useful medical observations. Patient made terrible jokes. Patient survived. Prognosis. Excellent. Recommendation. Add warning to human medical protocols about possible anesthesia resistance. Secondary recommendation. Increase hazard pay for surgeons treating human patients. He paused, then added one final note. Humans are absolutely insane. But I am beginning to understand why the rest of the galaxy finds them so terrifying. It is not just their physical resilience. It is their refusal to accept that some things should be impossible. They wake up during surgery and act like it is merely inconvenient. They survive injuries that should be fatal and complain about the recovery time. They turn nightmare scenarios into opportunities for casual conversation. He saved the report, then leaned back in his chair and closed his eyes. Tomorrow, he would begin writing his paper. Tomorrow, he would deal with the inevitable questions from his superiors about the irregular procedure. Tomorrow, he would start the process of updating the medical protocols for human patients. But tonight he would simply sit here and marvel at the fact that he had just performed surgery on a patient who had been awake, aware, and actively helpful throughout the entire procedure. Humans. Absolutely insane. He was definitely going to need that drink. The first sign that something was wrong came exactly 37 hours after Marcus Vale's surgery. Thrix was in the medical bay cafeteria, trying to convince himself that the gray paste the food synthesizer insisted was nutritious protein supplement was actually edible, when his communicator chirped with the emergency tone. Not the standard alert, the emergency tone, the one that meant someone was actively dying. He dropped the tray, paste and all, and ran. Well, Thrix did not technically run. His species had 6 legs, and rapid movement looked more like a scuttle, but the intent was the same. He moved fast, his medical bag clutched in his lower right arm, his mind already cycling through possibilities. Please not Marcus, he thought. Please let it be anyone but the human who woke up during surgery and made jokes about his own spleen. It was Marcus. Of course it was Marcus. The human was sitting upright in his recovery bed, which was already a violation of the strict bed rest orders Thrix had given him. But that was not the emergency. The emergency was the blood. Marcus's medical gown was soaked with it, a spreading crimson stain that suggested internal bleeding, and his face had gone pale in that particular way humans looked when they were on the edge of shock. Before you panic, Marcus said, his voice strained but steady, it is not what it looks like. You are bleeding. Thrix shouted, his professional calm evaporating like water on a hot engine. You are bleeding everywhere. That is exactly what it looks like. Quilix was already at the monitoring station, her 4 eyes wide and moving between screens. Vitals are stable. Blood pressure is dropping but not critically. Heart rate elevated but responding appropriately to stress. Internal monitoring shows no rupture of the surgical site. Thrix stared at her, then at Marcus, then at the blood. Explain, he demanded. Now, Marcus grimaced, pressing his hands against his side. About an hour ago I started feeling weird. Not painful, just weird, like pressure building up inside my abdomen. I told the night nurse, but she said it was normal post-operative sensation and gave me some medication for it. And then? Thrix prompted, already moving to examine Marcus while his mind raced through diagnostic possibilities. And then I coughed, Marcus said. Just once. Regular cough, nothing major. And something popped inside, and suddenly I was bleeding from my nose, my mouth, and apparently my incision site decided to join the party. Thrix froze mid-examination. You coughed. I coughed. Goughed. And that caused catastrophic bleeding from multiple sites. Apparently. Thrix looked at Quilix. Quilix looked back at him. They both looked at Marcus, who, despite being covered in his own blood, still managed to look more annoyed than terrified. This is not normal bleeding, Quilix said slowly, scanning through the medical data. The pattern is wrong. It is too uniform, too widespread. This is not a surgical complication. This is something else. The chemical irritant, Thrix said suddenly, his mind making connections. The orange fluid from the cargo loader. I flushed it out, but what if trace amounts remained? What if it has been slowly building pressure in the lymphatic system and the cough provided enough force to rupture the smaller vessels? Marcus blinked at him. That sounds really bad. It is really bad, Thrix confirmed, his forearms already moving, gathering supplies, preparing for what needed to happen next. If the chemical is in your lymphatic system, it will continue to cause bleeding until we remove it completely. But to do that, I will need to perform another surgery. Immediately. Okay, Marcus said without hesitation. Do it. Thrix paused. You understand what I am saying? I need to open you up again. Less than 2 days after your last surgery. The risk of infection is high. The risk of complications is extremely high. You might not survive this. And if you don't do it, I will definitely not survive it, right? Correct. Then we don't really have a choice, do we? Marcus said. He tried to smile, but it came out more like a grimace. Besides, we work pretty well together, Doc. You have got the steady hands. I have got the inside view. You will be unconscious this time, Thrix said firmly, even as he was mentally calculating anesthesia dosages that might actually keep a human under. I am going to use enough sedatives to put down a Graxian battle cruiser. You will not be providing commentary. We will see about that, Marcus muttered, but he was already lying back down, letting Quelix prepare him for emergency transport to the operating theater. The next 10 minutes were controlled chaos. Thrix assembled his surgical team, explained the situation in rapid-fire detail, and watched as they transformed the operating theater into a battlefield against contamination and time. Marcus was prepped, sedated with triple the normal dose of anesthetics plus 2 additional suppressants, and placed under monitors that would scream at them if anything went wrong. He is under Quelix confirmed. All brain activity shows deep sedation. He should remain unconscious. You said that last time, Thrix reminded her. This time I am more confident. Thrix made the first incision, carefully following the same path he had closed just 37 hours earlier. The flesh parted under his scalpel, and he felt a professional satisfaction that his previous work had been healing well, before the chemical contamination had ruined everything. I am seeing the irritant, he announced, identifying the orange-tinged fluid that had infiltrated Marcus's lymphatic vessels. It has spread further than anticipated. This is going to take time. He began the painstaking process of flushing each contaminated vessel, using a specialized solution that would neutralize the chemical while preserving the delicate tissue. It was tedious work. Precise work. The kind of work that required absolute focus and steady hands. Hey, Doc, Marcus said. I think you missed a spot. Every single being in the operating theater stopped moving. Thrix very carefully set down his instruments. Very carefully looked up at Marcus's face. Very carefully considered his life choices. Marcus's eyes were open, alert, focused. I gave you enough sedatives to render an entire military unit unconscious, Thrix said, his voice frighteningly calm. How are you awake? I told you I have a weird metabolism, Marcus replied. Also, I can feel the chemical irritant. It tingles. Left side, about 4 centimeters from where you are working now. There is a concentration of it there. Thrix looked at where Marcus had indicated. There was indeed a small pocket of the irritant, nearly invisible against the surrounding tissue, exactly where the human had said it would be. Your medical file, Thrix said slowly, is going to be the size of a small library by the time we are finished. I will autograph a copy for you, Marcus offered. Now, can we please get this stuff out of me? It really does not feel great. You can feel it, Thrix repeated flatly. Yep, feels like tiny bubbles of acid under my skin. Not painful exactly, but wrong. Your body knows when something is in there that should not be. The junior surgeon, a young Vexian named Prill, who had been assisting with the procedure, made a sound that suggested he was reconsidering his career choice. Thrix sympathized. He had been reconsidering his own career choices every 10 minutes since Marcus had arrived on his ship. "Fine," Thrix said, because at this point, what else could he say? "You can stay awake. But you will remain absolutely still. You will tell me if you feel any concentrations of the chemical, and you will stop making me question the fundamental nature of reality." Marcus agreed. "There is another pocket. Upper right quadrant. Small one." Thrix found it. Of course he found it, because Marcus was apparently capable of mapping his own internal contamination through sheer force of will and stubborn human biology. They fell into the same strange rhythm they had established during the first surgery, but this time with an edge of urgency. Thrix worked methodically, flushing and cleaning, while Marcus provided real-time feedback about where the chemical irritant was hiding. It should not have been possible. By all known medical science, a patient should not be able to sense the precise location of a chemical contaminant in their lymphatic system. But humans, as Thrix was learning, did not particularly care about what should or should not be possible. "Tell me something," Marcus said after about an hour of work. "Do you enjoy being a surgeon?" The question caught Thrix off guard. "That is a strange thing to ask while I am performing emergency surgery on you. We have got time, and talking helps me stay focused." "So do you?" Thrix considered the question as he carefully irrigated another vessel. "Yes," he said finally. "Despite everything, despite the stress and the emergencies and the patients who refuse to stay unconscious, yes. I enjoy it. There is something profound about holding a life in your hands and knowing that your skill, your knowledge, can make the difference between death and survival." "That is a good answer," Marcus said. "I like that. You care about your patients." "Of course I care. What kind of doctor would I be otherwise?" "You would be surprised how many doctors do not," Marcus said quietly. "I have had surgeries before. Back on Earth, before I left to work on the freight stations. Some of those doctors treated me like a problem to solve, not a person to heal. You are different. You see me as both." Thrix felt something warm spread through his chest, an emotion his species typically reserved for family members and close companions. "You are both," he said gruffly. "A very complicated problem attached to an annoyingly stubborn person." Marcus laughed, then winced. "Oh, laughing pulls on things that should not be pulled on right now. Then stop making me say things that are amusing." "I will try. Hey, there is more chemical near my liver. Feels like a line of it, like it followed a vessel." Thrix adjusted his approach, following Marcus's guidance. The human was right again. There was a thin line of contamination tracking along a lymphatic vessel, nearly invisible until you knew exactly where to look. "How are you doing this?" Thrix asked. "Honestly, how are you sensing these locations with such precision?" Marcus was quiet for a moment. "I do not really know how to explain it. It is like when you have a splinter in your finger. You cannot see it, but you know exactly where it is because your body is telling you something is wrong in that specific spot. This is like that. But internal. My body is screaming that there is something foreign in these locations, and I am just translating that sensation into information you can use. Your proprioception is extraordinary," Quelix observed from her station. "Most species have limited awareness of their internal state. Humans apparently have detailed sensory mapping of their internal organs. Or maybe I am just really motivated to get this stuff out of me," Marcus countered. "Survival is an excellent teacher, remember?" They continued working. Thrix flushed vessel after vessel, removing every trace of the chemical irritant while Marcus guided him to concentrations he would have otherwise missed. The human's color slowly improved as the contamination was removed, his vital signs stabilizing as the crisis passed. "I think that is the last of it," Thrix said finally, completing one more thorough scan of the surgical field. "I am not detecting any more chemical presence." "Me neither," Marcus confirmed. "Everything feels normal now. Well, as normal as having your guts on display can feel. Then we close, and this time you will remain on strict bed rest for a full week. No moving, no coughing, no developing any new and exciting medical emergencies." I will do my best, Marcus promised. But my body does not always listen to my brain. That much is evident, Threx muttered, beginning the closing procedure. This time, as he sutured the layers of tissue and muscle, he reinforced everything with surgical adhesive and extra support structures. He was taking no chances. Marcus Vale was going to stay in one piece if Threx had to personally supervise him 24 hours a day. All done, Threx announced, sealing the final layer of skin. You are officially closed. Again, please try to stay that way. I will make it my personal mission, Marcus said, sounding exhausted now that the immediate danger had passed. Thanks, Doc, for everything. I know I am not the easiest patient. You are the most difficult patient I have ever had, Threx said honestly. You are also one of the most interesting, and I am genuinely glad you survived. Me too, Marcus said. Being alive is surprisingly enjoyable. Quilix administered the post-operative medications, this time with enough sedatives that even Marcus's superhuman metabolism would be forced to shut down. She set up the monitoring equipment, muttering prayers in her native language to deities Threx was fairly certain she did not actually believe in. He is sleeping, she confirmed. Finally, actually sleeping. Threx nodded, too tired to speak. His arms ached. His head throbbed. He felt like he had aged another 10 years. But Marcus was alive, stable. The chemical contamination was gone. The crisis was over. I am going to my quarters, Threx announced. I am going to sleep for 12 hours. If anyone needs me, they can wait. If the ship is on fire, they can still wait. If the universe is ending, wake me in 11 hours so I can witness it. He made it halfway to his quarters before his communicator chirped again. Not the emergency tone this time, just a standard alert. He seriously considered ignoring it, but professional responsibility won out over exhaustion. What? He answered, perhaps more sharply than was strictly professional. Dr. Threx, came the voice of Commander Yalrix, the ship's captain. I have been reviewing the medical logs from the past 2 days. I need to speak with you about your patient, Marcus Vale. Threx's stomach sank. Here it came. The reprimand for irregular procedures. The investigation into why he had allowed a conscious patient to participate in his own surgery, possibly the end of his career. I can explain, he began. No need, Yalrix interrupted. I have read your reports. Both of them. Very thorough. Very detailed. Absolutely insane. But thorough. Yes, sir. Dr. Threx, do you understand what you have accomplished? That was not the question Threx had been expecting. I performed 2 emergency surgeries on a human patient with unusual complications. You performed 2 successful surgeries on a patient who remained conscious and actively assisted in his own treatment, Yalrix corrected. You documented a previously unknown human ability to sense internal contamination. You adapted to an impossible situation and still achieved optimal results. This is groundbreaking work, Doctor. Threx blinked all 6 of his eyes in succession. I thought I would be reprimanded. For what? Saving a patient's life? For demonstrating exceptional adaptability under pressure? Doctor, I am recommending you for the Galactic Medical Excellence Award. This case will be studied in medical schools for generations. Oh, Threx said, because his brain had apparently decided to stop producing coherent thoughts. That is unexpected. I imagine your patient is full of unexpected developments, Yalrix said dryly. Keep him under observation for as long as necessary. And doctor? Try to get some sleep. You sound exhausted. The communication ended. Threx stood in the corridor, processing what had just happened. His career was not over. In fact, it might be better than ever. All because a human had refused to stay unconscious during surgery and had turned a medical nightmare into a collaborative procedure. Humans. Absolutely insane. He continued to his quarters, finally allowing himself to feel the full weight of his exhaustion. He collapsed onto his sleeping platform and closed his eyes, expecting to immediately fall into unconsciousness. Instead, his mind kept replaying the surgeries. Marcus's calm voice, the human's uncanny ability to sense his own internal state, the way he had joked and talked and provided useful medical information while his organs were exposed to the air. It occurred to Thrix that in 50 years of practicing medicine, he had never had a patient who trusted him as completely as Marcus had. The human had been awake, aware, and vulnerable, and he had never once questioned Thrix's skill or decisions. He had simply helped, providing information and observations, turning himself into an active participant in his own survival. That level of trust was humbling. It was also terrifying because it meant Thrix could never allow himself to fail. Not with Marcus. Not with any patient, but especially not with the stubborn human who had somehow decided that being conscious during surgery was merely an inconvenience to work around. Thrix finally fell asleep with that thought in his mind. He woke 8 hours later to another alert on his communicator. This time it was a message from Quilix. Marcus is awake and asking for you. He says it is not an emergency, but he would like to talk. I have confirmed he is stable. All vitals are normal. No new bleeding. He is just awake and conversational. Of course he was. Thrix dragged himself out of bed, went through his morning routine, and made his way to the medical bay. He found Marcus sitting up in bed, looking significantly better than he had the night before. The human's color was good, his eyes were clear, and he was picking at the food synthesizer's attempt at human-appropriate nutrition. This tastes like cardboard mixed with sadness, Marcus announced as Thrix approached. But I am eating it because Quilix threatened to sedate me if I did not. A wise threat, Thrix said, conducting a quick visual examination. How do you feel? Sore, tired, hungry for real food, but alive, so I am counting that as a win. How are you? You look tired. I am tired because I spent yesterday evening removing chemical contamination from your lymphatic system while you provided helpful commentary despite being under enough sedatives to kill most beings. Yeah, sorry about that, Marcus said, sounding genuinely apologetic. My body is difficult. Your body is impossible, Thrix corrected. But it is also fascinating. I have never encountered a species with such detailed internal proprioception. Is that what we are calling it? Internal proprioception? Do you have a better term? Marcus considered this. Body sense? Internal awareness? The ability to feel when things are wrong inside me and communicate that information? Those are all accurate descriptions, Thrix acknowledged. Whatever we call it, it saved your life. Without your ability to sense the chemical concentrations, I might have missed some of them. The contamination could have continued spreading. Then I guess my weird body is good for something, Marcus said with a slight smile. So what happens now? How long am I stuck in this bed? 1 week minimum. Possibly longer, depending on how your recovery progresses. You will need regular monitoring, daily scans to ensure no new complications arise, and strict limitations on your physical activity. Sounds boring. Staying alive is frequently boring, Thrix said dryly. The alternative is significantly more boring. Marcus laughed at that, carefully holding his side. Fair point. Okay, 1 week of bed rest. I can do that. Can I at least have something to read? Or watch? The ceiling is not very entertaining. I will have Quilix set up entertainment access for you, Thrix promised. Human media, if we have it in our database. Awesome. Hey, Doc. Thank you. Seriously. You could have just followed standard procedures and hoped for the best, but instead you listened to me, trusted my observations, and worked with me to get the job done. That means a lot. Thrix felt that warm sensation in his chest again. You are welcome, Marcus. It has been an educational experience. Educational is one way to put it, Marcus said. Terrifying is another. Both can be true. They talked for a while longer, discussing Marcus's recovery plan, the medications he would need, the physical therapy that would help him regain full function. It was a normal professional medical consultation, the kind Thrix had conducted thousands of times before. but there was an undercurrent of something else: mutual respect, understanding, the bond that formed between doctor and patient when they had faced death together and won. As Thrix prepared to leave, Marcus called out to him. "Doc, one more thing. When you write that paper about this, about me staying awake during surgery, make sure you mention how good your work was. You are an excellent surgeon. You deserve recognition for that." Thrix paused at the doorway. "I will mention that my patient was remarkably cooperative and provided valuable insights that contributed to the success of the procedures." "That works too," Marcus said with a grin. Thrix left the medical bay and returned to his office, where his computer was waiting with a blank document ready for him to begin writing his paper. He stared at it for a long moment, considering how to explain what had happened, how to convey the sheer impossibility of performing surgery on a conscious patient, how to describe Marcus's ability to sense internal contamination. In the end, he decided to simply tell the truth. Humans, he wrote, are the most infuriating, fascinating, and resilient patients in the known galaxy. They wake up during surgery and make jokes. They sense chemical contamination in their lymphatic systems. They refuse to die when by all logic they should be dead. They turn medical nightmares into collaborative procedures. They are absolutely insane. And working with them is the most challenging, rewarding, and educational experience a doctor can have. This is the story of Marcus Vale, the human who finished his own surgery. Thrix leaned back in his chair, reading the words on his screen. They were good words. True words. He began to type the full case study, documenting every detail, every conversation, every impossible moment. This would be his legacy. Not the thousands of routine surgeries he had performed, but this one case. This one impossible, stubborn, friendly human who had taught him that sometimes the best medicine was simply listening to the patient, even when the patient was telling you things that should not be possible. Somewhere in the medical bay, Marcus Vale was probably making terrible jokes to Quelix while she tried to maintain professional decorum. Somewhere on Earth, humans were probably doing other impossible things, surviving situations that should be fatal, refusing to accept that some things could not be done. And Thrix, for the first time in his 50-year career, was genuinely excited about what came next. Because if one human could do what Marcus had done, what else were humans capable of? What other medical mysteries would they present? What other impossible situations would they turn into opportunities for collaboration? The galaxy would probably never be ready for humans. But Thrix was beginning to think that maybe, just maybe, that was a good thing. He saved his document, made himself a cup of his species equivalent of tea, and continued writing. He had a story to tell, and the galaxy needed to hear it. Humans were here. They were impossible. They were resilient. They were stubborn. They were friendly. They were insane. And they were absolutely, undeniably remarkable.